What happens if an enemy state attacks your country? Your defense system tries to fight against the intruder and safeguard your country. But if the attack happens continuously from all fronts, the defense system will try to fight against it. But after a point, if your defense system is not strong enough, you may lose the battle. Similar to this, our body also has an amazing defense system. Good morning, this is Dr. Padma from Pledze, and today we'll talk about immune system and inflammation. Immune system is our body's healing system. When our body encounters an offending agent like viruses, bacteria, or toxic chemicals, or suffers an injury, it activates our immune system. The immune system sends out its first responder, inflammatory cells and cytokines, substances that stimulate more inflammatory cells. These cells together begin an inflammatory response to trap the bacteria and other offending agents. The result of this entire process can be pain, swelling, bruising, or redness, all symptoms of inflammation. This can make the person uncomfortable. Acute inflammation is thus seen as problematic, although it's a normal response of the body and aids in recovery from illness. There are two types of inflammation. Acute inflammation, that's the response to a sudden body damage such as cutting your finger or an infection due to bacteria or virus leading to symptoms like fever, redness, pain and swelling. Once the offending agent, which is virus or bacteria or toxin, has been contained, the inflammation comes down and healing of the injured tissue begins and results in formation of a scar. Now the second one is a chronic inflammation. While inflammation plays an important role, no one should have inflammation chronically. This happens in certain conditions when the body continues pumping out the inflammatory cells as the offending agent has not been completely thrown out of the body, or if there is a continuous low-level exposure to the toxin. Toxin in this case can be continuous exposure to industrial toxins, pollutants, or lifestyle factors like consuming an unhealthy diet full of processed food, sugar, fats, or addictions like smoking or alcohol. Other lifestyle factors like unhealthy BMI, lack of exercise, and chronic stress can all contribute to ongoing chronic inflammation in the body. The body is in a state of chronic inflammation, and this can lead to the immune cells attacking neighboring healthy tissues too. Too much of good is also sometimes bad, right? It is like the body is in a constant state of alert and there's always a low level inflammation in the body. This can lead to chronic diseases like rheumatoid arthritis, Alzheimer's, cancer, diabetes, and heart disease. In rheumatoid arthritis, the inflammatory cells attack the joint tissues, leading to an inflammation that can cause severe damage to joints with pain and deformities. Another example of chronic inflammation is being overweight. If you're overweight and have more visceral fat cells, that's the deep type of fat that surrounds your organs, the immune system may see those cells as a threat and attack them with our defense cells, which are the white blood cells. The longer you're overweight, the longer your body can remain in a state of inflammation. How do we treat inflammation? Inflammation may not always require treatment, especially acute inflammation. Just rest, ice, and good wound care often relieve the discomfort in a few days. But in chronic inflammation, certain vitamins like vitamin A, vitamin C, vitamin D, and supplements like zinc may help in reducing inflammation and enhance the repair. The use of spices with anti-inflammatory properties such as turmeric, ginger, or garlic may also provide some relief. Over-the-counter medicines also tend to lower inflammation. Example, ibuprofen or naproxen, that is the non-steroidal anti-inflammatory drugs. When the above methods do not reduce inflammation, doctors may sometimes recommend corticosteroid shots to to decrease inflammation, especially if it is at a specific joint or muscle. How can we test the levels of inflammation in our body? Certain blood tests like C-reactive protein, which indicates infections or inflammation in the general body, like in the joints. Or there is high sensitivity C-reactive protein called hsCRP, which reflects inflammation of the heart. These are the tests to know the levels of inflammation in the body. ESR or erythrocyte sedimentation rate also helps in knowing if there is any inflammation in the body. What can you do to reduce chronic inflammation? What you eat can play a major role in regulating your immune system. You may choose to follow an anti-inflammatory diet. Some research shows that people who follow a Mediterranean diet have lower levels of inflammation in their bodies. Eat more foods that have anti-inflammatory properties, such as whole food plant-based diets, which contains phytonutrients and antioxidants, and they help in fighting inflammation. The more the color on your plate of fruits and vegetables, the better it is to reduce inflammation. Example: blueberries, strawberries, leafy greens, spinach, tomatoes, carrots, yellow capsicum, to just name a few. Eating too much of certain foods may increase inflammation. So if you have chronic inflammation, you may feel better if you avoid those foods. It's like fast food items, fried foods, cured meats with nitrates such as hot dogs, highly refined oils and trans fats, refined carbohydrates such as sugar, pastries, or white bread. Quitting smoking, limiting alcohol, maintaining a healthy weight, managing stress can all play a major role in decreasing inflammation. A 2017 study in Brain Behavior and Immunity Journal found that just 20 minutes of moderate intensity exercise can have an anti-inflammatory effect. Eat right, move more, stay happy, be positive. Help your defense system to thrive and fight your enemies better.